Good afternoon. I want to thank everybody for being here. Needless to say, Tuesday night was an exciting night. The people of the state spoke in a loud volume across the state, what direction they wanted this state to go, and I appreciate all the support from around the state. And for Teresa and I, we were honored to be the governor and first lady of the state of Missouri and continue to be in that role. I also want the everyday Missourians to know we're going to be working forward. No matter where you're from, what part of this state, I represent all Missourians and will continue to do that as governor of the state of Missouri. And some more good news today. Amazon announced plans to open its first fulfillment center in Republic, Missouri. The new fulfillment center, which is expected to launch in 2021, will create over 500 new jobs, full-time jobs, with industry-leading pay and comprehensive benefits starting on day one. This is great news for our state as we continue making progress with the economic recovery. As you know, COVID-19 cases continue to increase in Missouri and across the Midwest. We continually monitor the data from work very closely with the Missouri Hospital Association to monitor the statewide healthcare system and ensure adequate resources and capacity. The state has plenty of hospital beds, but the situation that can become an issue and that we are watching closely is hospital staffing. Since very early on, we have focused on finding ways to help MHA with staffing needs. We have waived over 600 regulations, including many to help the hospitals and healthcare providers with staffing needs and other COVID-19 challenges. We have allocated over $5 million to expand broadband for telehealth across the state, and we removed barriers to allow doctors to treat more patients through telemedicine. And to help with the long-term staffing needs of COVID-19, we continue to emphasize the importance of workforce development and have helped fund nursing program expansions at Missouri Western University and St. Louis Community College. As I said last week, we are going in on 9 months of dealing with COVID-19. For almost 9 months, our healthcare workers have been on the front line without a break. They are tired and overwhelmed, but they continue to rise to the challenge and take care of Missourians, and we cannot thank them enough. The governor's office and our entire administration is here to support our healthcare workers and healthcare delivery system in any way we can. We are very thankful that the majority of Missourians with this virus have made full recovery, but there are many Missourians who are hospitalized, on ventilators, or passed away. We do not take this lightly, and our thoughts and prayers are with these Missourians and their families. The bottom line is that COVID-19 is still here, and it is serious. Like I've said since day one, we must do our part and take responsibility for our actions. Social distance, wearing a mask, and washing your hands. Politics has played an important role in how we've handled COVID-19. When people have tried to make the mask a political issue in the state of Missouri, all across the country. But I want to tell Missourians, that mask is very important. But if you're not doing the remainder of those things with social distancing, staying away from large gatherings, making sure you're not with somebody for 15 minutes, all of those things is really how we're going to get around the curve on the coronavirus. But we have to do all three of those things, just not one. But it is time that we all realize how important each one of those issues are. And I know that COVID fatigue has set in for many people. However, it is critical that we stay focused and continue to be disciplined in our efforts, especially with winter, flu season, and the holiday seasons approaching. We also continue to focus on testing and expanding our capacity across the state. To date, Missouri has received 565,000 Abbott Rabbit antigen tests from the federal government. We have distributed over 300,000 of those tests, including 214,000 through K through 12 schools. So far, 293 public and private K-12 schools and districts have received shipments of this test. This afternoon, we are heading over to the SEMA warehouse where they are preparing another shipment to be sent out today. As COVID-19 vaccine is also progressing rapidly. Multiple vaccines are currently in production while being tested in large-scale phase 3 trials. Protocols for safety and effectiveness are being aligned, which allows the trials to proceed more quickly without sacrificing safety. Back on May the 1st, I was joined here by Christina Smith from Pfizer to announce that their Missouri facility was scaling up operations for COVID-19 vaccine production. And I am proud to say that Pfizer facility in Chesterfield, Missouri is leading the way on this critical, important global development. The vaccine is currently expected to be the first available vaccine. Throughout this year, Missouri has led the way in the distribution of federal allegations. From rapid testing equipment and supplies, the Binax Now antigen testing, the ID Now PCR testing, to the treatment of remdesivir. Missouri has been considered a thorough leader in this area, and this will only continue when a vaccine becomes available. It has been a busy and exciting week. We're back in the office yesterday to walk through the next several months. Today is also the beginning of a special session on the supplemental budget. We appreciate the General Assembly for coming in to get this done, and we look forward to working with them to make sure these funds are distributed across Missouri as soon as possible. Next week, we have several more meetings and events scheduled, as well as our Veterans Day on Wednesday. There is a lot going on in our state right now. We have come a long way, but there still is much more work to be done. We will continue working hard for the people of this state, protecting health and safety, and moving Missouri forward. It is an honor and privilege to be the 57th governor of the state of Missouri. God bless. All right, Dr. Williams.
Thank you, Governor, and thank y'all so much for being here today. I stayed up past my bedtime on Tuesday till 10 to listen to the governor, and I heard him say that we will be hard at work tomorrow. So I figured I better get to bed, and I got up at 3:30 and started back over. We've been doing this since January 27th, as the governor has said. I think one reason that we're in the position we're in, where we have much more resources than we did back in March and April, as we got started so early in January. I'm going to use the analogy with you today. You know I like to run. And right now we're in the steep part of the curve going up a hill, and that's throughout the Midwest. I looked at the numbers early this morning. Illinois, Iowa, Kansas have had more cases per 100,000 in the last 7 days than us, and Arkansas and Tennessee are right behind us, but we're right about 16th. And so we realize that now, through a confluence of time, the disease moving out more to mid-state Missouri, winter, more people being indoors, that not only are you seeing this in the Midwest, but you're seeing this throughout the United States, that this is the tough part of going uphill. I would tell you that as we go up the hill, and I think about that when I run up the stairs at the Missouri Bridge to come back home after my runs on the Katy Trail, I see Kurt, and I always have to thank him for introducing me to the Katy Trail, that there is a top of a hill, and that when you get to the top of the hill, it gets easier. And we think that's the vaccine, and I'm going to talk a little bit more about that. But let me tell you about the steep part of the hill we're on now. Today we're reporting out 3,500 cases. Those are real. We had the second largest ingestion of tests and data last night of 22,000, but that was not a backlog to the best of our ability. That those 3,500 represent community spread. Our hospitalizations are stable but high. They are increased, but we are stable there when we look at our capacity. But we watch it like a hawk, again, because we are well aware that it has increased. You look at our positivity rate, approaching, depending as the governor has eloquently stated, whether you're looking at the CDC numbers or our numbers, but it is at a very much increased number than what it's been. And we think that is real. It's a reflection that we're doing a lot of testing, over 100,000 tests a week. We're now doing Binax and antigen testing. But we think the positivity rate reflects that we truly have community spread throughout Missouri. And so our message is very, very clear. As we're in the steep part of this hill, as we're going uphill, due to the length of time the disease has been here since March 7th, and with the winter approaching and people being more inside, you just have to accentuate what the governor just said, which is hand washing, social distancing. If you can't social distance, wear a mask, and choose judiciously where you are and where you go. We believe that people are contracting it from people they know. It's not going to Schnucks or Walmart as much as it is the 6 people that you know, your son, your daughter, your family members, your friends, people you gather with at different occasions. That's where we think we're seeing the transmission. So you've just got to be very sensitive to that. And so we know that people have been at this, but our goal remains the same. We do not want one single person in Missouri to get COVID-19, because I spend a large part of my day calling people and talking about the sequela or the complications of that. Even if they don't get sick, it's very disruptive. So that remains our North Star. I want to talk about the top of the hill, which is the vaccine. Incredibly exciting. I had a one-on-one call with General Perna, the Chief Operating Officer of Operation Warp Speed, on Tuesday. We had a great conversation. He was incredibly gracious to call us. We anticipate that Pfizer will ask for an emergency use for authorization at the end of this month. Originally, the plan was, I think I told some of you earlier, that when they requested it, they would immediately ship the vaccine, and General Perna said they have changed that. They're not going to ship it until they have the approval by Pfizer, but they think Pfizer will ask for that in about 2 or 3 weeks, and then as soon as it's approved, which they hope will be quick. But he emphasized they have no involvement in that. The FDA makes a decision, working with both public and private partners in the FDA, whether or not that's improved. Operation Warp Speed has no control over that. So in an optimal situation is what I'm giving you. And then once they do it, in parallel, the Vaccine Advisory Council and the CDC will approve it. The moment Pfizer, which is the leader, Pfizer and Moderna are 2 of the 6 that are going to be out first, they think. The day they receive their EUA, even though it won't finally be approved, because it has to go through the CDC and the Vaccine Advisory Council, they're shipping it out. And you'll get a press release tomorrow. As the governor said, one thing that Missouri has become a national thought leader in, there are many things, but one of them clearly is that when we get a federal allocation of anything, remdesivir, Binax Now test, the Abbott IDB machines, we get them out by land, sea, and air immediately. And so we have a very robust plan, which the White House sent to every state as kind of a model example, that once we have that, we will institute our phase 1 of our 3 phases of vaccine implementation. The Pfizer vaccine is 90 degrees below zero. It's ultra cold storage. It has to go to specific sites. You just can't put it in any hospital. And so we've already pre-positioned those and had very much appreciate our hospital partners and our research partners who have the capability to store vaccine at 90 degrees below zero. And we'll announce that tomorrow. I kidded General Perna, since it was being made in Missouri, couldn't I just drive my pickup truck over there to the loading dock and throw some in the back and bring it? And he said no, that we had to be fair. It will be going out to the whole country in a fair and equitable fashion. It will be distributed basically, mostly on population, he said. They're still tweaking that, but it'll be an allocation, and Missouri being the 18th largest state. We do not know how much we're going to get, so that's to be determined. So I want to tell Missourians that, yes, we are in the steep part of the hill, but the top of the hill is in sight. We think that the vaccine is the best way to get back to normal, and we're very encouraged about that. So with that, I'll stop and answer any questions, Kelly.
Dr. Williams, I don't know if you've had a chance to have your weekly conference call with the Hospital Association today, but have you been able to do anything for them about their transfer issues?
Yeah.
Getting patients from rural areas into hospitals that can provide more care than they can provide locally?
A great question. You know, Lee Norman and I are working on that, worked on it yesterday over in Kansas. So just to frame this for everybody, one of the issues we're running into is the diseases more in outstate Missouri is obviously our rural hospitals don't have the capacity of a Barnes-Jewish or a St. Luke's or a Cox or Mercy. And so normally you would transfer those patients, but I may have told you earlier that usually requires putting people on ventilators, and we don't want to put people on ventilators with COVID-19. That's one thing we've learned. And so that requires high-flow oxygen, but ambulances aren't capable of giving high-flow oxygen. So we're working, I was on a conversation this morning with our intensivists in our big hospitals, Kansas City, Springfield, and Robin Trotman in Springfield, and Mario in Kansas City, and others. The governor and I are on a phone call every Saturday to shore up helping those local hospitals take care of those patients with consultations and getting them resources. So to answer your question, we haven't had the call with the Missouri Hospital Association this week. I think it's next week. But we're very much focused on that, is how we help these rural hospitals care for those people in place. And that's, as we've learned, different than what we normally, our normal model would be, we'll put them in an ambulance, put them on a ventilator, and get them to one of the larger centers. Since we can't do that, Lee and I are working on that combined to come up with a solution that would work for both states. So thank you for the question.
Yes, thank you, Dr. Williams. Do you think that with many mid-Missouri schools switching back to virtual learning due to COVID-19 cases, whether that's adults or students, do you think that's the best process right now, and why?
Yeah, you know, I always tell you, I'm a big fan of Kit Bond, who told me the key was to listen. And so we've listened very clearly, Margie and I have, with Desi, and we are completely aware that throughout Missouri, you know, due to staffing shortages of teachers and students being quarantined, that it's disruptive. And so, to the CDC's great credit, the governor and I are on a phone call and every Saturday with infectious disease doctors, and we are aware of data that children just don't have either the prevalence or the infectivity, especially in the classroom. And we don't understand all of why that would be, but it just appears to be different. And we have some really bright infectious disease doctors here. One's Rachel Orscheln, and I just got off the phone with her, and we were meeting with the CDC at 2:30 today. And we're asking to talk to the CDC that based on this observational data, would it not make sense to look at that in a more rigorous fashion if, in fact, 12-year-olds in a classroom are not like 25-year-olds at Mizzou as far as their ability to get the disease or spread the disease and the mitigation factor. And the CDC has been highly supportive of that and said, you know, if y'all would be willing to do this, we think this would provide some very good data for the rest of the country. So we have another phone call with them today at 2:30. We're not at the point where we know exactly what that study would look like. But as I've told you all along, our commitment every day in an emerging novel virus is to keep learning. And we think Missouri is in a great position to share data with the rest of the country based on things that are already going on that might really change how the CDC looks at this. Long-winded answer to your question. I apologize, but I think it's a great question.
We'll take two more questions, Dr. Williams. We got to move along, Emily. Dr. Williams, Governor Parson said that there are still plenty of hospital beds here in the state,
right,
but he's a little concerned about staffing.
Yes.
When it comes to staffing, are we short staffing in the state? What does staffing look like if
Yeah.
we're concerned about it?
Yeah, it's a great question that leads into a bigger issue, which is we've traditionally looked at our hospital beds as licensed beds. And the federal government and others have said, well, just to have a licensed bed, but if you don't have people to staff it, wouldn't that be a different number? Does that make sense? And so, as I think I told you 2 weeks ago, the question came from this side, I can't remember who, that when we talk to hospitals about limiting factors right now, they tell us it's the staffing for the same reasons that other people are having issues. So we are looking at that very, very carefully to work with the Missouri Hospital Association, the Missouri State Medical Association, or what are the factors there, just as we're looking at schools, what are the factors that we can work with them to help them with staffing if they've identified that as one of the critical issues. So that is also ongoing.
Andrew, last question for Dr. Williams.
Dr. Williams, this might be a good question for you, but also maybe a good question for Governor Parson as well. Brian with MissouriNet has a story about the Missouri Veterans Commission and the spread of coronavirus there dealing with their airflow systems. Have you discussed that situation with them at all?
I have not personally. I'll defer that to the governor. We monitor that very closely. The Veterans Commission kind of in a whole government approach, and we see that information daily, but I'll defer that. I really would defer that either to the governor or to the Veterans Commission.
Thank you.
Thank you.
Governor Parson?
Thank you so much. Good afternoon, Governor. Two-part question. Good to see you. Number one, what is your main aim for the special session, the biggest thing you're trying to get accomplished there? And two, I do want to ask about the veterans' homes, because Lieutenant Governor Kehoe and I spoke, as you know, this week, and he told me that what's happened in the report that he read is that the airflow in these veterans' homes, there's issues. It can spread the coronavirus. It can spread the flu. He said basically funding is needed. Is that part of the special session as well to get them funding? Thanks.
Okay. First of all, in the special session, it has to do with the CARES Act funding, getting it out. I think it's $1.2 billion. I think we're just trying to get out that the door. I'm not familiar with the report that the Lieutenant Governor is referring to. I haven't seen anything of that. I know right now they're looking into different things, that we got people trying to figure out what happened during that time, but I'm not familiar with that.
Governor Parson, let's talk about COVID liability. Today, the House Majority Leader said something that he would like you to see expand the call for the special session. Do you have any intentions of possibly adding COVID liability to the calendar?
We've wanted to do COVID-19 from the beginning. We wanted to do it actually in veto session that was there. I just received that letter today as we start special session. So again, it's when the legislators, we get together and find out is there a plan to move forward, but I'm not, until we talk to them and have an agreement of how we're going to move forward. But what I can't do is go into a deal and it takes 2 months to get something done and we're up against session. So we'll be talking to them about it, but we just received that letter today.
On the campaign trail, you often tried to cast the decision on whether it would be freedom or socialism. You won by 17 points. Why do you think that message resonated?
Because I think people really want freedom. They don't want a socialist agenda. And I think what you're seeing around this country going on, where governments want to get in everyday people's lives, do more regulations, more guidance, do more mandates. That's not what people want. And I think Missouri sent a loud message that they're not in favor of that. And I think, again, I think at the forefront, you should always put what the people want and what freedom is. And I think Missouri, I mean, you look at the stats, you know how I won. I believe they believe in what we're doing. I believe they believe in a balanced approach. And we're going to continue to do that.
So to piggyback on that point, you have to go back to John Ashcroft to find somebody who won by as large of a margin as you as a Republican, but he had like Democratic supermajorities and you have Republican supermajorities. Obviously COVID-19 is top of mind, but are there any like big broad issues you want to tackle in the next 4 years? And are you going to be able to take some more risks because you're not going to be running for another term because you're term limited?
I don't know about the risk. I just try to do a good job every day. I don't worry about the risk too much. I don't think I've done that in 2.5 years. But what I will do is I will try to do the things I say I'm going to do. I hear everybody always say, I got a plan, I got a plan, I got a plan. You know, people are tired of hearing about plans. They want to know if you're literally going to deliver those plans. I think what you're going to see, hopefully when this election is done, we look at the numbers, I hope the things I did in the African-American community in St. Louis, the many times that I've been to the urban areas, bringing businesses like the USDA to Kansas City, to bringing Chewy pet food to Belton, Missouri. I think all of those things, what people are looking at. You know, the only thing I can say is I'm just going to be who I am. And that's how I'm going to move forward. And I'm going to treat people fairly in this state. And I want this state to do well. And I think that's what people want you to do as governor. I don't know what all the political numbers will be at the end of the day, but I think it was a huge victory, to say the least. And you know, from being in the media, what everybody was trying to make that case, that this was a tight race and all that stuff. And, you know, just a lot of political spin on it. But at the end of the day, people speak, and that's what I always answer to.
We'll take a couple more,
Good afternoon, Governor. Thanks so much. So with where hospitalizations are right now, and BJC has announced it's stopping elective procedures in St. Louis, what would you tell people who are worried about the recent hospitalization numbers?
Well, I think there's options to that. I think just what BJC is doing, you know, we understand that elective surgeries out there, those are things we can do to make additional space. I think there's things we could do if we had to, again, from whether it be the National Guard, whether it's the Corps of Engineers. But it's also a little different environment it was 8 months ago. But we're looking at all those things. My staff, my administration is working with the Hospital Association every day to be addressing those issues as far as that bed space. Again, all of this is a worry. So all of it's a concern. But I think the one thing that probably concerns me a little bit more is the people on the front lines. I mean, they just haven't had a break, and there's no magic cure for that. We're expanding these nursing schools, trying to get more nurses out there, trying to look at other resources we might have. But we got to continue to search for that and figure out ways to sure back them up on that.
Final question,
Governor, early voting. You had 2.99 million people go to the polls in this state, 800, or cast ballots, I should say, 828,000 of them did so before Tuesday. The election authorities in this state are able to process those ballots in advance of Tuesday, and they were able to count those ballots on Tuesday so that you had a count for all those early votes by 7 o'clock on Tuesday.
Right.
You just added the election day total to that. And if nothing else, it afforded you the opportunity to go out at 10 o'clock at night and accept an election victory rather than wait until 2 o'clock in the morning. My question is this: we were driven by COVID this time. A lot of people might look at that and go, why can't I do that every election? Are you prepared to support legislation that would provide for early voting, no excuses?
Right. Well, let me first go back and just say how much I appreciate the Secretary of State, all the county elected officials, and everything they've done toward this election. And you've seen Missouri steps up to those challenges. We haven't had a chance to go back and evaluate how all that come out. I'm sure we'll have that discussion someday to see where that's going, but I wouldn't make any predictions today how that'll end up. We know that has a sunshine provision at the end of this year, but I know this: our election went off really well here in the state of Missouri.
Would you support it? No excuses, no sir?
I don't know what that would be. I don't know what that would look like. You know, all I know is it went very smoothly. That's the Secretary of State would be the guy that I'd sure want to sit down and have a conversation with to see where we go. But I think, if things go well, I'm always a guy that's put it on the table and let's see what is the best way to go for the people of Missouri. And if that's a good way to go, I don't have any objections to it, but I want to evaluate that too. We'll take another question. First of all, Rudy, I'm not going to answer your question, whatever you're going to ask, but I'm going to tell you this. I am not going to respond to a C4 out of Virginia that is absolutely a propaganda news agency that come to the state of Missouri. I have been transparent as governor of the state of Missouri from day one to say who funds me and my campaigns and everything else. This political agenda, whether it's George Soros or people like him, of what you're going to be doing, it's not fair to Missouri outlets that where they hear every day, day in and day out, and trying to report the news to the people of this state. I'm just not going to recognize a nonprofit out of Virginia that is here but nothing but a political propaganda. All right, thank you all very much. Thank you.